Have you ever tried to actually, like, navigate the maze of government assistance programs?
Oh, yeah.
It can feel like you need a PhD
Right.
just to understand the eligibility requirements.
It's so true.
Right.
It's true. And I think it highlights a really crucial aspect of well-being that's often overlooked. And that's the social determinants of health.
Okay, let's unpack that term.
Yes.
Social determinants of health.
Yeah.
It sounds...
Full.
Yeah, it does.
It's a bit of a mouthful.
It sounds very like a
Yeah.
public policy textbook to me.
Yeah. But the concept is actually pretty simple.
Okay.
It just means that our health isn't solely determined by what happens in the doctor's office, right?
Right.
It's shaped by a much wider set of factors.
Okay.
Things like, do we have access to healthy food?
Can we afford a safe place to live?
Right.
Do we have reliable transportation to get to work, to school, to doctor's appointments?
Yeah.
And even things like social connections and the strength of our communities. All of these factors play a huge role in our overall well-being.
It's all interconnected, like pieces of a puzzle.
Exactly. They're all interconnected.
Yeah.
And unfortunately, when communities face significant barriers to these essential resources, it creates health disparities.
Right. And that's where an organization like Link Health comes in. I feel like they're doing some really groundbreaking work
They are.
to address these challenges. And they're doing it right here in Greater Boston. Yeah, that's right. I mean, their mission is really to bridge this gap between healthcare and social services because, you know, they recognize that someone who's struggling to put food on the table or keep a roof over their heads, they're not going to be in the best position to manage a chronic illness or prioritize their well-being.
So instead of just treating the symptoms,
Exactly.
they're trying to address
the root causes.
the root causes, yeah.
Exactly.
Yes.
And they do it through a really innovative approach. I think they really embed their services directly within healthcare settings.
All right.
So imagine you're at a community health center, maybe you're feeling overwhelmed, and there's this friendly face that offers to connect you with those often, difficult to navigate benefit programs.
Meeting people right where they are.
Exactly.
Both physically and emotionally.
That's right. Just eliminating those barriers.
Yeah.
And making it easier for people to access the resources they need to really live healthier and more fulfilling lives.
And they're laser focused on these underserved communities in Greater Boston.
Yes.
Places like East Boston, Roxbury, Dorchester.
Yeah.
Where the need is so significant.
That's right. Where their impact is most deeply felt.
What struck me when I was looking at the materials on Link Health is their commitment to data.
Yeah.
They're not just relying on good intentions.
No.
They're meticulously tracking their progress.
Yes.
And then they're using that data
Absolutely.
to refine their approach.
They're incredibly data-driven.
Yeah.
In fact, they've screened over 21,000 individuals, enrolled nearly 2,500 in various programs, and distributed over $2 million in financial assistance.
So those numbers are impressive.
They are.
But what do they actually mean for the individuals and the families that they serve? Can you kind of paint a picture for us?
Yeah, of course. Let's take the Supplemental Nutrition Assistance Program, for example.
Okay, SNP.
SNP.
Yeah.
Link Health has helped connect countless families with this vital resource.
So SNP, that's the program that helps families afford groceries.
Yes, that's right. And in Massachusetts, the average SNP benefit is around $250 per household every month.
Okay.
Now, it might not sound like a lot, but for a family that's struggling to make ends meet, that $250 can be the difference between having food on the table or going to bed hungry.
Right.
It alleviates so much stress and worry,
Absolutely.
allowing parents to focus on other crucial aspects of their lives, like their jobs or their children's education.
Yeah, it's not just about putting food on the table.
Right.
It's about providing that stability and that peace of mind.
That's right. That's just one example of the programs that Link Health can connect people to.
So it's not a one-size-fits-all approach.
No, not at all.
They're tailoring these services to the unique needs of each individual and each family.
Exactly. It's about empowering people to take control of their own well-being.
I love it.
By connecting them with the resources that will have the greatest impact on their lives.
This is all so fascinating.
Yeah.
I'm very eager to dive deeper into the specific programs that Link Health is offering.
Let's do it.
And how they identify the most pressing needs within these communities. So we've talked about the why behind Link Health's approach.
Yeah.
But now let's get into the how.
Yeah.
What are some of the key programs that they're using to address these social determinants of health?
So they cover a really wide range, and I think that speaks to just how interconnected all of these issues are.
Okay.
So, take something like LIHEAP, which is the Low Income Home Energy Assistance Program.
Okay.
And this helps families afford their heating and cooling costs, which is about more than just comfort,
Hmm.
especially in a harsh New England winter.
Absolutely. It
Yeah.
can be a matter of
Right.
health and safety.
It's huge. And so Link Health walks alongside individuals through that application process, making sure they can stay warm and safe all year round.
Yeah.
But it's not just about, keeping the lights on and the heat running.
Right. We live in a digital age.
Right.
I can't imagine how you could really function
Exactly.
without access to technology and the internet these days.
It's absolutely essential. And it's actually often overlooked as a social determinant of health.
Interesting.
So Link Health helps enroll people in programs like Lifeline and the Affordable Connectivity Program, which provide discounts on phone and internet services.
Okay.
And in fact, they've distributed over $524,000 in savings through these programs,
Wow.
which means families are staying connected, kids are able to do their homework online,
Right.
individuals can access telehealth services.
It's like opening up this whole world of possibility
Exactly.
that might not otherwise be there.
Yeah, and I think, what's interesting about Link Health is they don't just stop at the enrollment piece. Because remember how we talked about them being so data-driven?
Yes.
Well, they realized that just giving people information about programs isn't always enough.
Right.
Because people might be intimidated by the process or unsure if they qualify. So they utilize what they call active enrollment.
Active enrollment.
Mm-hmm.
What is that?
Yeah, so essentially they have trained staff and volunteers right there at those community health centers,
Okay.
ready to sit down with people one-on-one and guide them through every step of the process.
Okay, so it's that in-person
Yes.
helping hand.
Exactly. They address language barriers, they address digital literacy issues, and they build that trust, which is so essential when you're dealing with sensitive information.
It makes such a difference.
It really does. And it goes back to that data-driven approach because by tracking their outcomes, they realized that this active enrollment led to much higher success rates.
So they're constantly learning and adapting
Yeah.
based on these real-world results.
Exactly.
That's fantastic. But how does this active enrollment strategy translate to something like childcare assistance?
So you've hit on another really critical need here.
Yeah, because those childcare costs are astronomical,
They're huge.
especially here in Massachusetts.
Huge barrier for families.
Mm.
And so Link Health, they connect families with programs like the Child Care Financial Assistance Program, which is known as CCFA.
Okay.
And through CCFA, they've helped families access an average of $16,000 per child per year.
$16,000. That's life-changing
It is.
for a lot of families.
Yeah, absolutely. And it allows, people to suddenly, those opportunities become attainable, right?
Yeah. Previously unattainable.
Yes. And it's not just about the financial relief either.
Okay.
Link Health understands that, having access to quality childcare is actually linked to better health outcomes for children.
Makes sense.
It reduces stress on the parents, it allows parents to fully participate in the workforce, and it really strengthens that family unit as a whole.
Right, because there's all these different factors that are
Right.
playing on each other.
It's this positive feedback loop.
Right.
Where, one intervention can lead to a cascade of positive benefits.
It's like that saying,
Yeah.
it takes a village
It
to
does.
raise a child and support a family.
That's right. And it all comes back to that core strategy of integrating these services into the healthcare setting.
Right.
It's about recognizing that well-being is about much more than just our physical health.
Right. It's about addressing the whole person
The whole person.
in the context
This-
of their
yeah,
community and
understand.
all of the different factors.
It's that holistic perspective
Yeah.
that I think makes their model so impactful.
This is also inspiring, but I have to ask, how do they manage to reach so many people?
That's a great question.
Is it just about those partnerships with the healthcare centers?
It's definitely a crucial piece,
Yeah.
but it actually goes beyond that.
Okay.
They've really gotten creative with their outreach strategies,
So-
really utilizing, both digital tools and a little bit of old-fashioned ingenuity.
Okay. Now I'm really intrigued. Let's dive into those strategies and see how they're maximizing their impact. So they've got those in-person connections at the healthcare centers, but you mentioned digital tools and old-fashioned ingenuity.
Yeah, so you know how much we all rely on our phones these days?
Oh, yeah, constantly.
Well, Link Health sends out Over 750,000 text messages a year.
750,000 text
Yeah,
messages.
yeah.
Wow.
Sharing information about programs, deadline reminders, even offering like troubleshooting support via text.
So it's not just like,
Or
here's some
It's
information.
very much a two-way communication channel.
Okay. Are people receptive to that?
You would be surprised. It's actually incredibly effective.
Okay.
Because they've found that a lot of people, especially those with maybe limited internet access or who are intimidated by complex websites, they find text messaging so much more approachable.
That makes sense.
Yeah.
It's familiar.
Yeah.
It's how we communicate with everybody else.
Exactly. Everyone's got their phone.
Yeah, that's true.
Yeah.
What about the folks who maybe aren't as tech savvy?
Right. So that's where the old-fashioned ingenuity comes in.
Yeah.
Remember like those posters and brochures?
Oh, yeah. You see them everywhere.
Right. You'll see them in community centers, libraries. Well, Link Health makes sure that those materials are strategically placed throughout their partner healthcare facilities as well.
So even if you're there for a doctor's appointment,
Exactly.
you might see that and be like, oh,
Right.
I didn't realize there's help available for this.
And it plants that seed.
Right.
It lets people know that those resources exist and they're not alone.
Yeah, this multi-pronged approach is really fascinating, and clearly it's working.
It is.
But is it all in the methods?
That's a good question.
Or is there something else that Link Health is doing that's making them so successful?
It's a really insightful question. And, while their methods are clearly effective,
Yeah.
I think a huge part of their success boils down to their fundamental philosophy.
Okay, let's talk about that.
Okay.
Because what sets them apart from just like
Yeah.
a purely transactional
Right.
social services organization?
It's the relationship building.
Okay.
They don't see themselves just as a service provider.
Okay.
They are truly a partner and an advocate
Yeah.
for the communities they serve.
So it's not just,
Right.
here's a pamphlet, good luck.
It's let's sit down.
Yeah.
Let's have a conversation.
Let's figure this out together.
How can we support you? What are your goals?
Ah.
And how can we help you get there?
I love that. That makes so much sense.
It's recognizing that inherent dignity and resilience
Yeah.
of every individual and meeting people with that compassion.
Yeah. When you feel supported
Absolutely.
and you feel respected,
Mhm.
you're more likely to engage
Yes.
with those services.
Absolutely.
And advocate for yourself.
It's that empowerment that's
Yeah.
so crucial. And it's not about providing that temporary assistance.
Right.
It's saying, how do we equip you with the tools and the knowledge?
To succeed on your own.
Exactly.
Long term.
It's like that saying, give a man a fish, you feed him for a day. Teach a man to fish, you feed him for a lifetime.
Exactly.
Feels like Link Health is doing both. They're providing that immediate relief while also setting people up for that long-term success.
And they're constantly looking at the data to
Always.
see what's working.
Yes, making sure that they're constantly adapting
Yeah.
and refining their approach to best serve the community.
So could this model be replicated? Could other communities adopt what Link Health is doing?
I think it's certainly a question worth exploring.
Yeah.
There's no one-size-fits-all solution,
Of course not.
but their emphasis on those community partnerships,
Yeah.
the data-driven strategies,
Yeah.
and that truly person-centered care
Right.
provides such a powerful framework.
So there's no magic formula,
Right.
but there are key ingredients that
Yes.
other organizations, other communities can learn from.
Absolutely, and adapt to their
Cool.
own context.
It's been so insightful learning about Link Health
It really has.
and their approach to social determinants of health.
Yeah.
I'm sure our listeners are feeling just as inspired as I am by all this work that they're doing.
I hope so. I think what they're doing is a real testament to what's possible
Absolutely.
when we prioritize collaboration, innovation, and that deep commitment to equity.
This has been The Deep Dive. We'll catch you next time
Thanks for having me.
for another fascinating exploration.